Today's session will be primarily from a lung cancer perspective, right? We'll talk about what it is, how prevalent it is, and what you can do about it. Talking about prevention as well as screening, and what to expect, if in the worst case you are diagnosed with it, right? During this sort of session, I would love for it to be as interactive as possible, but also, because we have multiple people, it becomes hard to have a communication, when it's vocal. So what you can do is you can just put all the questions you have at any point into the chat. And at the end of the session, which should not be more than 30 minutes tops, we'll have a real-time question answer going wherein all those questions will be answered by me. And if any other questions you have, you can put them in as well, right? So yeah, anytime you have a question, just put it into chat. All right. Okay. So this is just the general overview. First of all, what exactly is cancer, right? There's a lot of misunderstanding about what a tumor is and what cancer is, right? So we'll discuss that. Then we'll talk about risk factors. Some of them we're all super familiar with, but others might be a little new to us. We'll talk about which ones we can change or do things about and which ones are a little bit out of our control. And if it's out of our control, what does it mean for us, right? We'll also talk about how much of a problem lung cancer is, right? We'll talk statistics as well as what the impact of that is in a population. And we'll talk about screening. This is a little bit, hard to talk about because in India, screening for lung cancer is not routinely done, right? Despite the risk factors. Then we'll talk about, just a quick condensation of whatever we discussed, right? So yeah, quite simply, if you want to look at the numbers, it is definitely the top 5 cancers diagnosed in India, right? And more than 100,000 cases or 1 lakh cases of lung cancer are diagnosed every year in India, right? I believe just 2 weeks back, the report about cancer statistics in India came out, and lung cancer is at an all-time high compared to historically, right? So what is the difference between benign and malignant, right? So not every sort of growth or tumor is cancer, right? So for example, if you've got a mole or something like that, not all moles are cancer, right? So a tumor or a growth of normal cells, right, that causes symptoms only because of its size, right? Like it's a large tumor is present, and there is no metastasis. You might have heard of this word, right? Metastasis basically means spread, right? So something growing here should not be growing in my brain or in my spine, right? So that can be a benign tumor. So only when these cell growth that is abnormal starts losing its structure, starts spreading into nearby organs, and moves sometimes even to other parts through blood or lymph, only then is it metastasizing, in which case it becomes malignant or a cancer, right? So normally, you don't have to deal with this. Your pathologist will deal with it, right? So you do biopsies to see how the cells are, right, in any tumor to figure out if it's benign or malignant, right? And based on that, your course of action changes, which your doctor will guide you through. So why does it matter, right? So you have to understand that there's different types of cancer. Even lung cancer has different types. You've got small cell, you've got carcinoma, you've got bronchial, many different types. And so what determines this is the type of cell that is growing and also how it's spreading, right? Is it just physically spreading? Is it spreading through blood? Is it spreading through lymph nodes, right? So you have to understand that, the purpose of this session is awareness, right? Your body has mechanisms in place to prevent cancer. But despite that, the incidence of cancer is increasing, right? So what do you do about that? It's quite simple. Risk reduction. We'll talk about which risk factors specifically very soon. And screening, right? So if you have a high risk, then you need to screen more regularly. It's just common sense. Okay. And it's super important to understand, like we said, benign tumors versus malignant. Not every growth is cancer. So benign growths are way commoner, right? So between 7 to 9 out of every 10 growths is benign, right? So just because you've got something, don't think it's the end of the world. Definitely go get it checked, looked at, speak to your doctor, and then proceed. Okay. We talked a lot about risk factors. So you've got 2 types: modifiable, which is something you can do something about. So exposure to carcinogens, which are substances that increase your risk of cancer, right? Your dietary changes, your exercise levels, smoking, of course, extremely relevant in cancers. Alcohol intake, again, very relevant in cancers. Lack of fun and stress, right? It's quite strange, but the presence of stress actually changes certain hormones in your body, like cortisol, adrenaline, and that in turn can have a long-term impact on your health, right? lack of sleep. Right? Lack of sleep is linked to a lot of comorbidities these days. Then you got non-modifiable risk factors, things like your genetics, your family history, your race, that's which country you belong to in some ways, and your ethnicity, as well as comorbidities, that is diseases that you already have, right? So, for example, someone with diabetes is more likely to have a BP or hypertension as well, right? Right. So, if we go into a little bit more detail, the modifiable risk factors that we talked about, some of them are lifestyle related, right? Like your diet, your exercise, whether you're obese or not, whether you smoke or you're, consuming alcohol. Some of them can be occupation related as well, right? Some jobs require you to inhale more smoke, right? Little bit less relevant if you're a white collar worker, right? You might be inhaling certain fumes like asbestos if the building you're living in is really old and outdated, or working in is old and outdated, right? Things like that. Radon is not very relevant, especially in the Asian continent. Carcinogen exposure. So again, smoking is one of them. Nitrosamines. So they're found in pickles, right, or smoked foods. Asbestos again, and diethyl carbestrol, which is normally associated with vaginal cancers. Then radiation exposure. So radiation exposure is more relevant if you're working at a hospital, right, more than anywhere else. Even there, you take a lot of precautions like wearing a lead apron, right. The last thing is if you have poor immunity. So, a lot of people think that if I don't have enough vitamin C, I have poor immunity. In this case, the kind of immunity we're talking about is if you have been diagnosed with HIV/AIDS, right? If you have a disease called severe combined immunodeficiency, which is a genetic disease. If you've got a transplant, so people who get, liver or kidney transplants, for example, they have to have immunosuppressants, right, which reduces their immunity. So I think the one risk factor we're all the most familiar with will definitely be smoking. So the interesting thing is that smoking kills 4 times the number of people through heart disease than through lung cancer, right? But that doesn't mean that it kills fewer people from lung cancer, right? The absolute number is actually really large. But lung cancer, thankfully, is the most well-known. That's why you might have seen the sort of warnings on cigarette packets, right? You have oral cancer as well as lung cancer, both of which the risk increases when you smoke. And sort of something that is very important to get clear is that all smokers are not the same. As in, if you're someone who's smoking 20 cigarettes versus someone who's smoking 2 cigarettes, you do not have the same risk, right? When compared to someone who's not smoking, absolutely, your risk is way higher. But even reducing 1 cigarette a day is a good step to take, right? So there's something known as pack years, which means that if you're smoking 1 pack a day, that's 20 cigarettes a day for a year, that's equal to 1 pack year, right? So if you sort of crossed a threshold of pack years, 20 pack years, then your risk is much higher compared to the normal population and even other smokers. Okay. So definitely try to quit or reduce it well before you reach that threshold, right? And there's more than enough evidence and data to show that quitting smoking is much easier if you're speaking to a therapist or your primary care provider or even a psychiatrist, because it's not just about patches and gum, right? Some people might need medication to help them quit, to reduce cravings, to reduce headaches that might come because of it, right? Because substance dependence is something that has both mental and physical symptoms, right? Yeah. So we talked a little bit about smoking. Family history is something we should talk about a little bit more in depth, because see, that's out of our control, right? So if you have a history of lung cancer in your family, then it's important for you to be a little bit more aware, right, of your symptoms. For example, if you had a cough for 2 weeks, right? Suppose you're a 40-year-old female who's had a cough for 2 weeks, and it doesn't seem like an infection, and you have a history of lung cancer, it might be worth speaking to your family doctor or your GP and just give them that additional insight that I have had a history of lung cancer in the family, right? And they might ask you to get screening done in that case. Apart from that, everything else you already talked about, right? We talked about how if you've got a job that puts you at risk, and asbestos, silica dust, things like that, and if you've got other illnesses, your risk goes up, right? Something that's important to note is air pollution. So the report that came out, like I said, a couple of weeks back, also showed that amongst non-smokers, air pollution was actually a significant contributor to the development of lung cancer, right? So it might be worthwhile wearing masks while heading out, especially if you live in a metropolitan city, right? Because particulate matter size 2.5 and 5 mm, these are the ones that have the sort of worst impact on your lungs, right? So definitely try to wear masks when you go out, even if it's in a post-COVID era. So a little bit about oral cancer, just because you can see that smoking and smokeless tobacco or gutka is associated with oral cancer as well, right? So same things, if you've got an alcohol history, a family history, if you've got a poor diet, all of these also increase your risk of oral cancer, right? So when you talk about screening, you can see that when you talk about lung cancer screening, only high risk individuals are usually screened for lung cancer, right? So who is a high risk individual? Again, these are not screening guidelines that are followed in India, right? However, in Western countries, you do have this basic guideline that says you can screen someone who has more than 30 pack years. Remember, we talked about pack years before, who's been smoking for more than 30 pack years and who's more than 55 years of age. Maybe it's useful to screen someone using a CT, chest CT, a low dose CT, to figure out if they have lung cancer or not, right? Otherwise, sort of the most important thing to keep in mind is if you notice shortness of breath or difficulty in breathing, right? If you notice chest pain, right? If you notice blood in phlegm or anything unusual that develops and progresses rapidly, and if you've got a history of smoking, you should definitely speak to your doctor, right? Because they'll be able to guide you further. So about oral cancer, every 2 to 5 years, screening is advised. And the screening is not anything, right? You just go and see a doctor and they examine your mouth, right? And they see if you've got any whitish or reddish plaques, right? That's the first sign of, something that can convert to cancer. These are precancerous lesions, right? The whitish or reddish colored lesions that come in your mouth that you can't rub off, okay? Now, when you screen, so this is basically, a list of commonly done cancer screens. And you can see very clearly that there is only one over here, which is called CEA, right? That is used for lung cancer. So it's not very commonly done, just for the simple reason there's no real use of it, right? The CEA is usually used to see if your response to chemotherapy or any kind of treatment on cancer is good or not. So you might see a lot of packages online that say that, screen for lung cancer by checking CEA. So it's not necessary that just because you have a low CEA, you don't have cancer. And also a relatively high CA is not a guaranteed sign you have cancer. So the use as a test, screening test, is not very good, right? So then you come to the simple question that what do you do if I notice something abnormal? Okay, we talked about a bunch of the abnormal things. We'll discuss them again. So unfortunately, you can't directly go to an oncologist or an oncosurgeon who are cancer specialists, because the total number of oncologists and oncosurgeons in India is under a few thousand, right? And you have 1.4 billion Indians. So you have to start with primary care, right? Your GP, your family physician, right? Or anyone who you normally speak to, your primary care doctor, will guide you on screening. So you can tell them that, hey, I have noticed that, I had some blood in my cough, right? I am a smoker. And then your GP will then do some basic tests, right? And then will refer you up the pathway to reach that oncologist, right? For the simple reason that false positives are quite common as well. Okay. So if it's a false positive, you shouldn't have to get, chemotherapy or radiotherapy just because of a false positive, right? So then normally a biopsy will be done before you're diagnosed with a cancer, right? Until then it's screening. So let's see what we mean by abnormal things. Okay. The most common symptoms of lung cancer are a cough that gets worse or a cough that stays for a long time. Like I said, right? If you're getting a cough that you had for months, you must always check for tuberculosis and cancer, right? If you've got a cough that gives you, blood in your phlegm or in your spit, that's always something to worth check out, right? If you've got chest pain that gets worse when you breathe in deeply, chest pain that gets bad when you cough or you laugh. If you've got any hoarseness, right, when your voice is changing, that's normally a good sign that, there's something wrong with your throat. Now, loss of appetite, weight loss, which you're not trying for, feeling tired or weak, these are very non-specific symptoms, right? But the thing is that they can often be the earliest signs, right? Because these things we looked at, coughs, blood in your sputum, change in voice, they might be later, right? But these things are very important to look out for: the loss of appetite, weight loss, as well as feeling tired, right? And of course, if you're wheezing suddenly, right? If you don't have a history of asthma or you've not had asthma for a while and you're wheezing suddenly, it's definitely important to check it out, right? Why is it come up? So apart from these direct lung or chest symptoms, you also have um, symptoms of because of metastasis, which if you remember we talked about was how cancer spreads in your body, right? So if the cancer spreads to bones, right, like your hips, right, then you will have pain, right, in your back or your hips. If it's spread to your brain, then you might have headaches, weakness, paralysis of some points, any seizures, things like that. Of course, if it spreads to the liver, then you'll have, jaundice, which is yellow skin, right, and eyes. Okay. And of course, you might see lymph node swelling, right? Very common symptom that is seen in case your cancer is spreading via lymph nodes. Okay. Keep in mind that not all lymph node swellings are cancer, right? If you have an infection also, your lymph nodes will swell up. Okay. It's not very specific. But just, the simplest thing to do is speak to your GP. And that's quite easy to do, right? Especially if you have telehealth these days. So let's say, in a hypothetical situation, if you ever diagnosed with a malignancy, you go up the pathway until you've been assigned an oncologist or an oncosurgeon, who will then decide the best treatment for you based on your tumor type, where the tumor is, right, and how it's spreading. So you might have heard a lot about chemotherapy, which are very effective side effect laden medication, right? Oftentimes they have very severe side effects due to the toxic nature of the medication which is required. Then you've got radiotherapy, which is basically radiation based. Again, there are quite a few side effects, right? Your bone marrow is affected, your hair cells are affected, right? Your hair follicles. Then there's surgery. Again, oncosurgery just removes the tumor, right? Again, it is quite effective, but also not always an option, right? Depends on the site of the tumor. And normally you take different options of this tumor to sort of um, optimize how you approach a tumor, right? It could be a combination of chemotherapy and surgery sometimes, right? So what about survival? You might have heard of these 5-year survival rates, right? So what is this 5-year survival rate? The 5-year survival rate, first of all, understand it's just probability, okay? It's not a guarantee, it's a probability. 5 years after the diagnosis or not, okay? So keep in mind that this does not take treatment into consideration a lot of times. Okay. So for stage 1 cancers, it says it's around 65%, which means that 65 out of 100 people will live for more than 5 years after they're diagnosed. Right. Stage 2, as you can see, it comes down, it becomes around 40%. Stage 3, it comes down to 15%. And as you can see with stage 4, it becomes really low, around 5%. Like I said, this is no guarantee, right? There are people who have survived stage 4 and lived for 20 years, and there are people who have died from stage 1, right, within 2 years as well. So it's probability, right? These are not absolute numbers. What does it mean? What is the takeaway from this? It's as simple as understanding that the earlier you're diagnosed, the better your survival chance, right? Which is not something that is new to us, but this is sort of objective data showing that early diagnosis is incredibly important. Okay. Then we come to what affects your survival, right? So you saw these different survival rates. How does your survival rate change, right? Why are not what do all people live the same? No. So how long you survive depends on one, where the cancer is, right, and how early on you caught it, and also whether it has spread, right? So depending on the type of cancer, the spread rates vary. And the type of cancer means, sort of what is the original cell line it came from. Right. So we're talking about lung cancer. In lung cancer, also you've got different types. You've got small cell, non-small cell, right? So it depends. And of course, something which we can control is your general health and fitness at the time of diagnosis or the time of undergoing treatment. So, for example, something as basic as anemia, right? We've seen that people who have anemia have poor outcomes when it comes to just even normal surgery, also for cancers, right? So, the fitter you are, the better you may be able to cope with your cancer and the treatment for cancer, which, as you know, is quite intensive, right? When you talk about chemotherapy, radiotherapy, and surgery, right? So, genetic mutations will be discussed, right? So, any cancer, the first sort of thing it was doing a biopsy, figuring out whether it's cancer, where it's located, what type it is. Then you run genetic tests on it to see what type of chemotherapy will it react best to, right? And only then is your treatment started, right? So of course, the mutations that affect the treatment are important as well. Then sort of something we don't talk enough about is how important mental health is when it comes to cancer, right? Not just for people who have cancer, but for their caregivers, right? And people you know who have cancer, right? It is a diagnosis that is incredibly difficult to come to terms with, right? Regardless of age, regardless of education, regardless of gender, it's an incredibly difficult thing for someone to be diagnosed with cancer. So the loved ones of the person, their friends, even the therapists are all affected by it. So it's important to empathize with them, right? To You cannot offer them empty words, right? But at the same time, you have to reassure them, but never lie to them, right? You can't tell them that it's all going to be fine. You can't know that for sure. So it's important to listen, right, more than anything else. And I talked about 5-year survival rates and 10-year survival rates. So you have to keep in mind that these are statistical likelihoods, right? We have decades of research from which we've got this probability, but they are not absolute indicators of treatment or disease outcomes, right? Like I said, someone with stage 1 cancer might die in the first 2 years, and someone with stage 4 cancer might survive well beyond 10 years, right? So we cannot predict that. We can just hypothesize based on probability, right? So, sort of the main takeaways from this would be that one, not all growths and tumors are cancer, right? Two, your risk factors are modifiable and non-modifiable. So in case of modifiable, you've got smoking, you've got alcohol consumption, which is also associated with a lot of cancers, by the way, not just stomach cancers or liver cancers. You've got things like your exercise, your diet, right? And you've got a whole bunch of other risk factors you can do something about. Then you've got non-modifiable risk factors, which are things like your family history, right? Your race, your ethnicity, as well as genetic predisposition, right? So what is important in your part should be being more aware, right? So now we've gone through what are abnormal things, right? If you've got these symptoms, you have to be on the lookout and consult your GP, right? And you have to you're the first person who know when something is wrong with you. That's the baseline of it all, right? When you notice something is wrong, seek care, right? And keep in mind that the reverse is also true, right? We talked a lot about how family history is a sort of a marker for a higher risk of cancer. For that, you also have to keep in mind that family history is not a sort of death sentence, right? It does not mean you will definitely get cancer. Cancer itself is also not a death sentence, right? Care is improving day by day. But what does it mean? It means that you need to be more aware about screening, right? Maybe speak to your doctor and ask, if the screening we talked about, right, a low dose CT, is it required for you or not, right? That depends entirely on your genetics. So keep in mind that every kind of cancer is pretty much linked to smoking, not just lung cancer. If you ever wanted a sign that it's a good time to quit, this is the best time, right? And like I said, quitting is much easier if you've got access to a therapist or a GP or a psychiatrist to help you with the quitting process, right? And keep in mind that if your loved one is being evaluated or treated for cancer, do not underestimate the role of mental health, right? So, if you want to talk a little bit more about the diet and exercise part of things, right? Sort of these don't vary, right? There are certain very basic steps that everyone can take for diet and exercise to improve all health outcomes, whether it's cancer risk, whether it's risk of diabetes, whether it's risk of hypertension or heart disease. They're very simple. Number one is exercise. So the WHO, the World Health Organization, recommends around 150 minutes of moderate intensity exercise, right, per week. That can be broken down to 30-minute sessions 5 times a week. Okay. If you're doing that, that's a great sort of stepping stone, the sort of bare minimum you need to do. Now, don't think that just because, I don't think I can do that, you don't do anything. Some exercise is 100% better than no exercise, right? But this 150 minutes is sort of the cutoff beyond which your health drastically improves, right? From probability perspective. When it comes to diet, there's something known as a DASH diet, right? Which is the DASH. So the diet against starting hypertension, basically, right? So what it does is it allows you to prevent the development of hypertension, which is high BP, but also has a lot of protective role when it comes to cancer risk as well, right? It asks you to reduce your salt intake, right? Limit it to less than 1 tablespoon a day, right? And apart from that, it also asks you to reduce your consumption of meats, red meats especially, fried fatty foods, full cream dairy, right? Things like ice cream, butter, ghee, definitely reduce that. Right? It's almost like we know what is not good for us, right? So just stick to that gut feeling, and try to increase amounts of fruits and vegetables, especially raw fruits that are eaten, green leafy vegetables that are eaten, good amounts of fiber that you get from these things, right? And if you want to eat meat, try to eat more of white meat, fish, things like that, and eggs, which are a good source of protein as well. Okay. And if you're vegetarian, keep in mind that you are at a higher risk of iron deficiency as well as B12 deficiency. So you need to speak to your doctor about how you can prevent that, right? Or a nutritionist as well. So these are just sort of the studies that were used to talk about this. Right. So if you've got any questions, I'll just open the chat and go through them. If you've got any other questions also, please, now is the best time for you to put them in chat, right? We'll go through them all. And other than that, Plum has a great telehealth service, right? We've got all kinds of specialists, right? Nutritionists that I talked about, mental health experts, physicians, dermatologists, physiotherapists, orthos, everyone. And we've got 24/7 physician coverage as well, right? So in case you want personalized health doubts, you can ask over that, right? So yeah. All right. So any questions you have, now is the best time to sort of put it in chat. We'll be going through them. Okay. I mean, if there's no questions, that's pretty great. It means I either did a really good job or a really bad job, right? No worries. Okay. I have stammering. To control it, I do costal diaphragm breathing. While doing it continuously, I get pain at the chest. Okay. So, see, in this case, your pain is coming while you're doing the, diaphragmatic breathing, right? Normally, diaphragmatic breathing is not something that most people do naturally,